Hello, I'm Dr. Donald Ozello of Championhsip Chiropractic in Las Vegas, Nevada. Today on InformerTV, I'm going to be discussing and demonstrating some stretching exercises that you can perform to help combat the pain and symptoms of sciatica. Stretching the piriformis muscle, which is located right down here in the gluteal area, is very effective in helping to alleviate some of the symptoms caused from impingement on a sciatic nerve. Sciatica can be very debilitating. It is quite painful and usually attacks just one leg at a time, but that is enough to really cause some discomfort and to prevent you from moving properly. The sciatic nerve is the longest and thickest nerve in the body. It begins right back here in the gluteal region. How it starts is nerves branch off the spinal cord in the low back. Several of those nerves can bind together right down here underneath the piriformis muscle and become the sciatic nerve. The sciatic nerve and its branches run all the way down the leg. Branches go into the big toe. What the sciatic nerve and its branches do is it transmits nerve signals from the spine down to the leg and back. If there is impingement on a sciatic nerve, it can cause symptoms such as sharp shooting shock-like pain, numbness, fatigue, weakness, inability to move, pain when you're sitting, pain when you're standing, pain when you move the hip up, when you move the hip backwards, when you bend forward, when you bend backwards. Basically any major type of movements in the lower spine and in the hips can increase or elicit those symptoms of sciatica. What I'm going to do today is show you some very simple stretching exercises that you can perform that will help to loosen up the piriformis muscle and take some of that impingement off the sciatic nerve. The main area that the sciatic nerve gets impinged in is right underneath the piriformis muscle. It's actually what's called piriformis syndrome. The piriformis muscle is a big, thick muscle that turns the leg outwards. When that muscle is tight, it pinches down on the sciatic nerve, causing the symptoms. So what I want to do today is alleviate the source of the sciatica, which is tightness in the piriformis muscle. So that's what these stretches are aiming to do, is loosen up the piriformis muscle and help to remove the source of sciatica, which will help to alleviate the symptoms. The first stretch I'm going to be demonstrating is one you perform laying on your side. This stretch will help to hit the piriformis muscle. It's very simple to do. What you want to do is lay down on your side. If you have a training table like this, it's quite simple. If not, obviously you could use your couch or your bed. A firm bed always works better. When you lay down on your side, the bottom leg is straight, the top leg is bent at the hip and the knee. You can hook your foot behind the bottom knee and just let your knee stretch down towards the floor. You will start to feel a stretch right through here in the piriformis muscle. And to help increase that stretch, you take the hand of the bottom shoulder and you just push down slightly on the knee. That will help to increase the stretch right in through this area in the piriformis muscle. And you want to do it nice and light. Like I said before, you want to achieve a comfortable stretch and hold that for about 30 to 60 seconds. Then you get up and you switch sides. Even if the pain is only on one side, which it usually is in sciatica, you want to make sure that you stretch both sides. Obviously, you could do it more and you could emphasize the injured side, but it always helps to stretch both sides. The next stretch I'm going to be doing is one where you're laying on your back. In this stretch, you target the muscle at a little bit different of an angle. It's a little bit more of an advanced stretch, but it definitely targets those muscles and hits it very well. Now what you're going to do is you're going to lay down in a supine position, bend both knees, take the side you're going to be stretching, On this one, because the left side's closer to the camera, I'm going to be stretching this one. Bring the leg up so that so that the ankle is touching the top part of the thigh, the top part of the knee, the thigh right above the knee. You know, what you want to do is reach with both hands and pull the knee towards you. As you pull the knee towards your chest, you will begin to feel a stretch right back and through here. Now, like I said, this is a little bit more of an advanced stretch than the side-lying stretch, but it really hits those muscles well. Now, if it increases the symptoms of the sciatica, obviously you want to stop and move on to the next stretch. If it does not, and you want to find a comfortable stretch, hold that for 30 to 60 seconds and then move out of the stretch slowly and then switch to the other side. The last stretch that I'm going to demonstrate is a seated stretch that is almost the same as the last stretch that I did. This one you can do on a table like this that's a little bit higher, but it's almost more effective if you do it in an office type chair. I have instructed people to do this stretch while they are at work. Take a break for just a few minutes and stretch out the piriformis muscle. That helps to alleviate any symptoms that might be occurring. Now on this one I'm going to actually stretch the right hand side, and what you want to do is flex the hip and the knee, put the lower part of the ankle on the thigh right above the opposite knee. Some people, if they're very tight, they may already feel a stretch, or if the chair is a little bit lower, you may already feel a stretch. Now this training table's high, so I'm not feeling a stretch right now. But the key to that is start to feel a little bit of a stretch as you go down. Now what you want to do is, you can place one hand here if you like, but you don't have to. Curl your neck down and just start to stretch at the spine. As you start to bend forward, you will begin to feel a stretch in that piriformis muscle. Now this stretch is not as advanced as the same stretch done in the supine position, but it's still very effective. And it works very well when you have those symptoms or you're actually just trying to prevent those symptoms. Again, I'm going to demonstrate with the opposite leg. Now, you may not be able to see this on the video, but I'm actually coming up on my toes so that I will be able to feel a little bit better of a stretch. So I'm lifting up this leg that I'm stretching. Now, I'm in a good starting position. I'm going to push down a little bit on the knee. You don't have to do this, and if you have any hip issues, you should not do this. But I'm going to do it for the sake of getting a better stretch. I'm rolling my spine downwards. Starting to feel a little bit of a stretch right there. Like I said, it's a little bit easier if the chair is lower, but it's still a very effective stretch. All three of these stretches, plus several other ones for the piriformis muscle, will help to lessen the tightness of the piriformis muscle, which will help to eliminate the impingement on the sciatic nerve, which is the source of those sciatica symptoms. This has been Dr. Donald Ozello of Championhsip Chiropractic in Las Vegas, Nevada on InformerTV, discussing and demonstrating stretching exercises for the piriformis muscle that you can use to help eliminate the source of sciatica and alleviate the symptoms of sciatica. Stretch for health, stretch to eliminate the source of sciatica, and stretch to alleviate the symptoms. Again, this has been Dr. Donald Ozello of Championhsip Chiropractic on InformerTV.